Now to begin the macro or systemic level studies. Now the first one of interest is intrinsic skin aging. So this is aging that occurs on its own without direct damage from an expected environmental stimulant. So they looked at skin that was non-photo exposed. I believe they took it from the inner thigh in this study, and then they examined the effect of HBOT on the skin cells before and after. 13 subjects, so small sample size in this study. That's one of the problems. And some of them dropped out. They did 2 atmosphere, 5-minute air breaks every 20 minutes, 90-minute sessions, and they did 60 daily sessions of HBOT. And what they found was significant increase in elastic fiber length, average baseline of 6.94, up to 14.25, double from the averages, approximately. I mean, there's the plus or minus here, of course. Fiber fragmentation dropped from 90 to about 10%. No change was found in density or thickness of elastic fibers. Collagen density increased from 67.8 to 76.6. Again, there's plus or minus error here because it was a very small sample size. And a statistically significant decrease in papillary layer thickness. And again, this study is looking at intrinsic skin aging. So this is skin that was non-photo exposed, meaning that this is skin that's probably already in its healthier state. And this study still showed that there are incredible improvements with HBOT in the health of the skin. Collagen density is often linked to the appearance of aging in the skin. And so if you can increase collagen density, that likely means that your skin will stay healthier for longer. Now here, we're looking at cognitive health. So this study used what they call a D-galactose model. So essentially they inject D-galactose into rats for multiple weeks, and this simulates aging pathophysiology. They measured novel object location and hippocampal oxidative stress. And the hippocampal oxidative stress was significantly lower in the groups treated with HBOT. Approximately 100% decrease in relative oxidative stress for the normal diet group, and a 400% decrease in the high-fat obese group. So in this study, they also looked at different diets and obese and non-obese rats. So this is oxidative stress levels between the experimental groups. This is the high-fat diet group, so these were the obese rats. These were the normal diet groups, so these were the non-obese rats. Interestingly, something else noted was that HBOT restored insulin sensitivity, both in the aged rats and the aging and obese combination rats. And so one of the theories of mechanism is that insulin insensitivity may be linked to increased hippocampal oxidative stress and other mechanisms. And so if you are increasing insulin sensitivity and restoring that again, it probably helps prevent cognitive decline. Now again, this was a rat model, so it's not a perfect example. The next systemic effect is anti-osteoporotic effects. In this study by Emerb et al., this is again rats and a D-galactose group right here. However, there's a split of all these different groups. There's a normal diet and then a normal diet aged. Then there's a age group with HBOT. Then there's obesity groups and one that had the sham and then one that had HBOT. In the study, they looked at mRNA bone analyses, tomographic imaging, and bone ash analysis. To examining cellular senescence, they looked at these 2 markers right here. In this experiment, it seemed to show that the D-galactose was a pretty good model for aging, given the increased expression of these genes, and that HBOT prevented this aging effect and therefore decreased bone cellular senescence regardless of obesity. It also decreased hypoxia in bone tissues, as we looked at HIF-1A and 2A. Also decreased bone inflammation, better regulation of the osteoblasts. So there's a huge possibility for HBOT to be used as a potential treatment for bone pathophysiology. And then you can see in these tables right here, as it says above, the normal diet control group is the far left. The galactose aged group is Gal-S right here. So that shows increased P16, which seems to indicate cognitive decline. And then when they took that group, group 3, D-galactose aged and underwent it with hyperbaric oxygen therapy, it seems to come very close back to the baseline level of P16. And then this is the obese group, high-fat diet, galactose modeled, and then high-fat diet, galactose with the hyperbaric. And you can see pretty much across the board, with the exception of this one, the aged models seem to have substantially more expression of all of these genes, and hyperbaric oxygen therapy seems to bring it a lot closer to the baseline, which would indicate cellularly, via age-related mRNA markers, it's probably slowing down or preventing cognitive decline. Now, in this study, it looked at stem cell proliferation, angiogenesis, and wound healing. So they did a lot in this study together. So the first thing was that they looked at intestinal cells and determined that HBOT can modulate stem cell proliferation. Probably it's involved in the S phase. Second thing they looked at was angiogenesis, and they looked at chicken embryos. And here you can see just across the board in all of these different groups where they combined it with other possible treatments like wound dressing and, vascular endothelial growth factor combined with the dressing to see how the egg opening heals. Across the board, hyperbaric oxygen scores slightly higher than its control protocol, with the exception really of this IM plus VGF. Those are pretty much within the margin of error. And then, of course, each of these additional treatments seems to improve angiogenesis as well. And looking at this in composite, HBOT group had on average 14% more blood vessels than its respective control group. The final part of this experiment was testing wound healing abilities in mice, and the findings show that there was not much substantial difference between wild-type mice with and without HBOT. However, for the diabetic group of mice, the wound area of the HBOT group was approximately 50% smaller than the control group. So again, as linked to the previous studies, this seems to indicate that HBOT does have an effect on insulin sensitivity. As we know, the diabetic group probably has low insulin sensitivity, and as we said before, HBOT seems to indicate it can restore it. So that might be why it helped the diabetic group more than the wild type group. And then just to throw in some unsuccessful ones, because it doesn't cure absolutely everything. In one study, it didn't seem to have a significant clinical benefit to stroke recovery. I have heard some doctors talk more recently about that being very possible and very helpful. So I don't think it's worth writing off completely. This was just one smaller study. Another study seemed to indicate it was not very effective at treating autism. But again, I have heard some doctors mention that there might be new data on the subject. Hyperbaric oxygen therapy, I think, is one of the most exciting clinical prospects of the future because it has very minimal side effects. While it is expensive and inconvenient and requires an intensive protocol, the only side effects that seem to be shown are trauma to the inner ear, like barotrauma, due to the high pressure. Some people feel claustrophobic. And then in incredibly high doses, you can start to get oxygen toxicity and seizures, especially in individuals prone to seizures. But that is very, very rare and really only seen in cases where they're treating a clinical condition. And so they go even above the 2-atmosphere general protocol. These side effects, however, are incredibly rare and generally only occur at very, very high doses. Hyperbaric oxygen therapy, I think, is one of the most promising therapeutic modalities and is part of the future of medicine.